Well, as a parent, there's one phrase that your child can say to you that will really make your gut sink, and that's, "I don't feel good." And if your kid's forehead is warm, it's a sign that your day, possibly even your week, is about to change altogether. So in today's What's Going Around, we're talking about fevers. Our Lacey Beasley is back with a fever refresher course for patients, or parents, that is.
Hey, good morning, Carmen. Now, fevers don't have to be scary. It just means your body is fighting an infection. And doctors say you actually don't have to call them immediately when a fever does appear. Now, normal body temperature varies from person to person, but it's usually somewhere around 98.6 degrees. Now, a fever is when your child's body temperature is 100.4 degrees or higher. We spoke with Dr. Suessman at Medical City Children's Hospital, and she reminds us to treat the child, not the fever.
We want to let the body have its natural response, but most of us, including us adults, feel pretty uncomfortable when we have a temperature. And the comfort part is then being able to accept and allow us to encourage the fluid intake to prevent dehydration. You want to use acetaminophen or ibuprofen for kids above 6 months, following those correct dosing instructions on each medication to allow them to feel comfortable and allow the process of the virus or bacteria to pass while they're not getting dehydrated.
Now, Dr. Suessman says good hydration options include water or Pedialyte. You can even make your own popsicles just to make sure the sugar content is low and that your body can absorb the water. And if it's been a few days or 72 hours and your child isn't getting better, that's when you call your doctor. Now, there are cases where you should immediately call your doctor or go to the emergency room. And that's if your infant is 2 months or younger and has a rectal temperature of 100.4 or higher. And that's because their immune systems aren't fully developed yet. Anyone between 2 months and 6 months old with a temperature of 102 or higher, and anyone above 6 months old with a 104-degree fever.
104 is scary for families, and at least your pediatrician can evaluate your child, or if you're concerned or there's any concurrent symptoms, that's when you want to come to the emergency room. And so for me, the most worrisome situation isn't the height of the fever, it's the symptoms that are associated. So these are, if your child's very irritable, very difficult to console, they're unusually sleepy, hard to arouse, dehydrated, having trouble breathing, complaining about a stiff neck, really inability to move their neck in the same time as having a temperature, persistent vomiting, or a seizure.
Now, parents, here are your key takeaways. A fever is 100.4 degrees, and pay attention to how your child is acting and not just the number on the thermometer. Hydration and comfort should be your first steps in treating a kid with high temperature. Madison, Carmen.
I know, it's always one of those things that you kind of hit the panic button as soon as that thermometer reads above 100. And we got to keep them. Then you start rationalizing it, like, okay, there's steps I need to take. Keep them home from school for a couple of days, the whole shebang. Yeah.